Hello friends, it's me, your host. Welcome back to our channel. I hope you all are well and doing great. So today I'm back with another video to give you and talk about something new. So today we will talk about an acne, about its overview, causes, diagnosis, treatments, sys- symptoms, each and everything. But this video is just for information. You have to consult your physician about before using anything that is told in this video. So let's start with its overview. So today we're going to see or talk about acne. Acne is a common skin condition that affects most people at some point. It causes spots, oily skin, and sometimes skin that's hot or painful to touch. Symptoms of acne. Acne most commonly develops on the face. This affects almost everyone with acne. Back. This affects more than half of people with acne. Chest. This affects about 15% of people with acne. So this is the picture that this type of acne anyone can have on his or her face. Types of spots. There are 6 main types of spot caused by acne. First is blackheads. Small black or yellowish bumps that develop on the skin. They are not filled with dirt but are black because the inner lining of the hair follicle produces color. Whiteheads have a similar appearance to blackheads but may be firmer and will not empty when squeezed. Papules. Small red bumps that may feel tender or sore. Pustules. Similar to papules but have a white tip in the center, caused by a build up of pus. Nodules. Large hard lumps that build up beneath the surface of the skin. and can be painful. Cysts, the most severe type of spot caused by acne, they are large pus filled lumps that look similar to boils and carry the greatest risk of causing permanent scarring. Things you can try if you have acne. These self help techniques may be useful. Do not wash affected areas of skin more than twice a day. Frequent washing can irritate the skin and make symptoms worse. Wash the affected area with a mild soap or cleanser and lukewarm water. Very hot or cold water can make acne worse. Do not try to clean out blackheads or squeeze spots. This can make them worse and cause permanent scarring. Avoid makeup, skincare, and sun care products that are oil based, sometimes labeled comedogenic. Use water based, non comedogenic products as they are less likely to block the pores in your skin. Completely remove makeup before going to bed. If dry skin is a problem, use a fragrance free water based emollient. Regular exercise cannot improve your skin, but it can boost your mood and improve your self esteem. Shower as soon as possible once you finish exercising, as sweat can irritate your acne. your hair regularly and try to avoid letting your hair fall across your face. Although acne cannot be cured, it can be controlled with treatment. If you develop mild acne, it's a good idea to speak to a pharmacist for advice. Several creams, lotions, and gels for treating spots are available to buy from pharmacies. Products containing a low concentration of benzoyl peroxide may be recommended, but be careful as this can bleach clothing. If your acne is severe or appears and on your chest and back, it may need to be treated with antibiotics or stronger creams that are only available on prescription. When to seek medical advice. If you have mild acne, speak to pharmacist about medicines to treat it. If these do not control your acne or it's making you feel very unhappy, see a GP. You should see a GP if you have moderate or severe acne, or you develop nodules or cysts, as they need to be treated properly to avoid scarring. Try to resist the temptation to pick or squeeze the spots, as this can lead to permanent scarring. Treatments can take several months to work. The results are usually good. Why do I have acne? Acne is most commonly linked to the changes in hormone levels during puberty, but can start at any age. Certain hormones cause the increase producing glands next to hair follicles. In the skin to produce large amounts of oil or abnormal sebum. This abnormal sebum changes this abnormal sebum changes the activity of a usually harmless skin bacterium called P. acnes, which becomes more aggressive and causes inflammation, inflammation and pus. The hormones also thicken the inner lining of the hair follicle, causing blockage of the pores. Cleaning the skin does not help to remove this blockage. Other possible causes. Acne is known to run in families. If both your mother and father if both your mother and father had acne, it's likely that you will also have acne. Hormonal changes, such as those that occur during the menstrual cycle or pregnancy, can also lead to the episodes of acne in women. There is no evidence that poor hygiene or sexual activity play role in acne. Who's affected? Acne is very common in teenagers and younger adults. About 95% of people aged 11 to 30 are affected by acne to some extent. Acne is most common in girls from the ages of 14 to 17 and in boys from the ages of 16 to 19. Most people have acne on Most people have acne on and off for several years before their symptoms start to improve as they get older. Acne often disappears when a person is in their mid 20s. In some cases, acne can continue in adult life. About 3% of adults have acne over the age of 35. Next, we have causes. Acne is caused when tiny holes in the skin, known as hair follicles, become blocked. Sebaceous glands are tiny glands found near the surface of your skin. The glands are attached attached to hair follicles which are small holes in your skin that an individual hair grows out of. Sebaceous glands lubricate the hair and the skin to stop it drying out. They do this by producing an oiling substance called sebum. In acne, the glands become the glands begin to produce too much sebum. The excess sebum mixes with dead skin cells and both substances form a plug in the follicle. If the plugged follicle is close to the surface of the skin, it bulges outwards, creating a white head. Alternatively, the plugged follicle can be open to the skin, creating a black head. Normally harmless bacteria that live can on the skin can then contaminate and infect the plugged follicles, causing papules, pustules, nodules, or cysts. Testosterone. Teenage acne is thought to be triggered by increased levels of a hormone called syndrome. Hormone called testosterone, which occurs during puberty. The hormone plays an important role in stimulating the growth and development of the penis and testicles in boys and maintaining muscle and bone strength in girls. The sebaceous glands are particularly sensitive to hormones. It's thought that increased levels of testosterone causes the glands to produce much more sebum than the skin needs. Acne in families. Acne can run in families. If your parents had acne, it's likely that you will also develop it. One study has found that if both your parents had acne, you are more likely to you are more likely to get more severe acne at an early age. It also found that if both if also found that if one or both of your parents had adult acne, you are more likely to get adult acne too. Acne in women. Women are more likely to have adult acne than men. It's thought that many cases of adult acne are caused by the changes in hormone levels that many women have at certain times. These times include periods. Some women have a flare up of acne just before their period. Pregnancy. Many women have symptoms of acne at this time, usually during the first month or first 3 months of their acne. Pregnancy. Polycystic ovary syndrome. A common condition that can cause acne, weight gain, and the formation of small cysts inside the ovary. Acne myths. Despite being one of the most widespread skin conditions, acne is also one of the most poorly understood. There are many myths and conceptions. It Acne is caused by having dirty skin and poor hygiene. Most of the biological reactions that trigger acne occur beneath the skin, not on the surface. So, cleanliness of your skin has no effect on your acne. Washing your face more than twice a day could just aggravate your skin. Squeezing blackheads, whiteheads, and spots is the best way to get rid of acne. This could actually make the symptoms worse and may leave you with scarring. Sexual activity can influence have sunbathing, sunbaths and sun lamps help improve the symptoms of sun lamps help improve the symptoms of acne. There is no conclusive evidence that prolonged exposure to sunlight or using sunbeds or sun lamps can improve acne. Many medicines used to treat acne can make your skin more sensitive to light. So, exposure could cause painful damage to your skin and also increase your risk of skin cancer. Acne is infectious. You cannot pass acne on to other people. Acne and toothpaste. A claim found on many websites is that toothpaste can dry up individual while toothpaste does contain antibacterial substances. It also contains substances that can irritate and damage your skin. Using toothpaste in this way is not recommended. There are far more effective and safer treatments available from pharmacists or GPs. A GP can damage acne by looking at your skin. This involves examining your face, chest, or back for the different types of spots, such as blackheads or sore, red madules. How severe your acne is will determine will determine where you should go for treatment and what treatment you should have. The severity of acne is often categorized as mild, most white, mostly whitehead and blackheads with a few papules and pustules, moderate, more widespread whiteheads and blackheads with many papules and pustules. Severe, lots of large, painful papules, pustules, nodules, or cysts. You might also have some scarring. For mild acne, you should speak to a pharmacist for a wide for advice. For moderate or severe acne, speak to a GP. Acne in women. If acne suddenly starts in adult women, it can be a sign of a hormonal balance. Excessive body hair, hirsutism, irregular or light periods, the most common cause of hormonal imbalances in women is polycystic ovary syndrome. PCOS can be diagnosed using a combination of ultrasound scans and blood tests. Next, we have treatment. Treatment for acne depends on how severe it is. It can take several months of treatment before acne symptoms improve. If you just have a few blackheads, whiteheads, and support, a pharmacist should be able to advise you on how to treat them successfully with over the counter gels or creams, topical treatments that contain benzoyl peroxide. Treatments from a GP. See a GP if your acne is if your ac- if your acne is moderate or severe, or medicine from your pharmacy has not worked, as you probably need prescription medicine. Prescription medicines that can be used to treat acne include tropical topical retinoids, topical antibiotics, azelaic acids, antibiotic tablets in women with the combined contraceptive pill. If you have severe acne or prescription medicines are not working, your GP can refer you to an expert in treating skin conditions, dermatologist. For example, if you have a large number of papules and pustules on your chest and back, as well as on your face, you have painful nodules, or if you have scarring or are at a risk of scarring, your condition is making you feel very low or anxious. For mild to moderate to severe acne, you will usually be started on a combination of topical treatments or antibiotic tablets combined with topical treatments. Hormonal therapies or the combined oral contraceptive pill can also be effective in women who have acne. But the progest- progestogen only pill or contraceptive implant can sometimes make acne worse. Many of these treatments can take 2 to 3 months before they start to work. It's important to be patient and persist with the recommended treatment even if there is no immediate effect. Topical treatments gels, creams, and lotions. Benzoyl peroxide. Benzoyl peroxide works as an antiseptic to reduce the number of bacteria on the surface of the skin. It also helps to reduce the number of whiteheads and blackheads and has an anti-inflammatory effect. Benzoyl peroxide is usually available as a cream or gel. It's used either once or twice a day. It should be applied after washing to all parts of your face affected by acne. It should be used sparingly as too much can irritate your skin. It also makes your face more sensitive to sunlight, so avoid too much sun and source of ultraviolet light such as sunbeds or wear sunscreen. Benzoyl peroxide can have a bleaching effect, so avoid getting it on your hair or clothes. Common side effects of benzoyl peroxide include dry and tan skin, a burning, itching, or stinging sensation, some redness and peeling of the skin. Side effects are usually mild and should pass once the treatment has finished. Most people need a 6-week course of treatment to clear most or all of their acne. You may be advised to continue treatment less frequently to prevent acne returning. Topical retinoids. Topical retinoids work by removing dead skin cells from the surface of the skin, exfoliating, which helps prevent them building up within hair follicles. Tretinoin and adapalene are topical retinoids used to treat acne. They are available in a gel or cream and are usually applied once a day. Before you go to bed. Apply to all parts of your face. Affected by acne 20 minutes after washing your face. It's important to apply topical retinoids sparingly and avoid excessive exposure to sunlight and UV. Topical retinoids are not suitable for use during pregnancy as there is a risk they might cause birth defects. The most common side effects of topical retinoids are mild irritation and stringing of the skin. A 6 week course is usually required, but you may be advised to continue using the medicine less frequently after this. Topical antibiotics help kill the bacteria on the skin that can infect plugged hair follicles. They are available as lotion or gel that's applied once or twice a day. A 6 to 8 week course is usually recommended. After this, treatment is usually stopped as there is a risk that the bacteria on your face could become resistant to the antibiotics. This could make your skin or acne worse and cause additional infections. Side effects are uncommon, but can include minor irritation of the skin, redness and burning of the skin, peeling of the skin. Azelaic acid is often used as an alternative treatment for acne if the side effects of benzoyl peroxide or topical retinoids are particularly irritating or painful. Azelaic acid works by getting rid of dead skin and killing bacteria. It's available as a cream or gel and is usually applied twice a day or once a day if your skin is particularly sensitive. You will usually need to use azelaic acid for a month before your acne improves. The side effects of azelaic acids are usually mild and include burning or stinging skin, itchiness, dry skin, redness of the skin. Antibiotic tablets are usually used in combination with the topical treatment to treat more severe acne. In most cases, a class of antibiotics called tetracyclines is prescribed unless you are pregnant or breastfeeding. Pregnant or breastfeeding women are usually advised to take an antibiotic called erythromycin, which is known to be safer to use. It usually takes about 6 weeks before you notice an improvement in your acne. Hormonal therapies. Hormonal therapies can often benefit women with acne, especially if the acne flares up around periods or is associated with hormone conditions such as polycystic ovary syndrome. Ovary syndrome. If you do not already use it, a GP may recommend the combined oral contraceptive pill even if you are not. Support for acne. The British Association of Dermatologists is a charity that runs acne support. It gives advice about acne and includes a section about covering acne. There are also a range of informally run message boards and blogs about acne on the web. You may find it supportive to read about other people's experience of living with acne. For example, Talk Health provides a face acne support and information community. So this is all we have from this information about the acne. I hope this will prove helpful for you, but you always have to consult your physician before using any of these things. So I'll be back with another informative or interesting videos. Till then, just take care and goodbye.